a lot to learn in psychiatry regardless of whether you want to be a psychiatrist.
Learn as much as you possibly can.
It bridged the gap between physical health and mental health.
Don't be afraid of the unknown.
And I think you'll get a lot from it.
I realised what the consultant and trainee relationship could actually be like.
There's so much to learn on psychiatry that is really important for your practice, whatever speciality you go into.
As a foundation doctor about to start a placement in psychiatry, you may be wondering what to expect and what you learn. You might have heard mixed reviews of psychiatry or have concerns about losing your medical skills. But you will hear from this film that this really isn't the case. The skills you will learn in psychiatry will be relevant for any specialty you choose and are increasingly important for all doctors. The health and social care landscape is changing. People are living longer and are suffering with complex, long-term conditions. They expect their doctors to treat them as a whole person, understanding both their physical and mental health care needs. You are now about to hear from a range of doctors talking about their experiences of a psychiatry placement in the Foundation programme.
Every Tuesday I'm in the community with the early intervention service. So this is a service for people with first presentation of psychosis. So it could be a GP referral. It's a really good opportunity for me as a junior doctor because I get to do an assessment of someone who hasn't really seen anyone else and present my findings to my consultant.
I was able to still work in the hospital, so I still had the benefit of being networked in with the other F1s and feeling part of things, but then I got to look at things from a slightly different angle. I got the experience of seeing serious major mental illness presentations in the A&E department and in the general hospital, and also I got the chance to look at the more psychological side of medicine and to try and see my patients as whole people.
One day you could be dealing with a patient who's having chest pain or a patient who is having stomach trouble. The next day you can have somebody who wants to leave the ward and you have to speak to them and your seniors about whether or not they need to be put under a section. Sometimes on calls I'd have patients in crisis, mental health crisis, that would need managing and assessing and discussing treatment options with seniors as well. So no such thing as a standard on call.
I tended to be on the ward all the time, which was really good because I got to know all the patients really well, and so I tended to be the person that often knew where we were at with their plans.
We can do home visits as well, which is quite interesting because you don't really get to do home visits in many other posts.
I think some of the main skills that you'll learn as a foundation doctor in psychiatry would be types of communication that are perhaps difficult, sometimes asking questions that might seem difficult or awkward without making a patient feel uncomfortable. That's something you end up doing quite a lot in psychiatry, and it's something that's actually a useful skill to have regardless of where you work in medicine.
It's made me more confident managing kind of aggressive and disturbed patients and kind of de-escalating them. Before I wouldn't really know kind of what to do, how to do it. Now I'm quite confident in quite a structured, logical process of kind of helping those people.
I think I also learnt about the benefits of multidisciplinary working because within the ward rounds you'd have the consultant, you'd have nurses, you'd have a psychologist, an OT, and seeing how the MDT functions together I think is something really helpful and would be useful again in whatever career you go into as a doctor.
Risk assessment was something that I did quite a lot of, and that really gave me confidence to try and understand what the seriousness was behind someone's actions and communications.
Conflict avoidance would be an important one, and that's where usually if something is happening in terms of a patient getting very agitated and perhaps even physically aggressive, you learn that your voice may be all that's required sometimes, and just being calm and confident to talk to someone and say, what's happening, you know, how can I help?
The supervision I got in psychiatry was excellent, very supportive, a lot of time to talk through cases, a lot of time for teaching, and it was very much kind of a friendly approach.
The main consultant I worked with was absolutely amazing, and it's one of those people that stand out from your medical career somebody who's really, really inspirational. She was absolutely fantastic, and somebody takes you under their wing and really looks after you.
In my foundation post in psychiatry, I had an hour every week which was put aside for supervision with my consultant. We tended to think about it in advance, what we'd do that week. Sometimes it would be an in-depth case discussion about an interesting patient. Sometimes it would be one of my workplace-based assessments, or sometimes if there was just an area I was more interested in, we could have a small teaching session.
I attended Ballant Group. I think we had it once a month, and as much as I could attend after going to the first session, a little bit against my will, I went to every session after that. I think that it's something that if we had the ability to do it in all specialties would actually help trainees really quite a lot, as well as trainers.
One of the really useful things about that job was the psychological discussion group. We had a consultant psychotherapist come every couple of weeks to talk to us about some of the patients we'd seen. And there was one of the cases that I sort of carried home with me was a young gentleman who's in his early 20s who'd come down with a medically unexplained symptom that was causing him a huge amount of suffering. And that psychological discussion group was a way that I was really able to try and understand where that had come from and how that was affecting him and how to best help him.
The support was fantastic. I always had a registrar on the end of the phone that I could ring, and I also had fantastic consultants that I felt completely able to call if I needed to. I felt really supported and never felt like I was on my own.
Don't be scared. It's a very kind of relaxing, supportive environment, and I think you'll get a lot from it. So just enjoy it, really.
I think I'd say have an open mind. It will be different to other posts that you have done, but different doesn't necessarily mean bad, and you will learn a lot of things and you'll learn a lot of key skills that will definitely stand you in good stead whatever career you're going to do, because you will need to talk to people unless you're doing pathology or something. And so the communication skills you get in that respect, and the ability to sometimes talk to people who are a bit agitated, angry, sometimes even physically intimidating, it teaches you a lot of skills.
Throw yourself into it because you will learn a lot just by the osmosis of being around colleagues who are in that specialty and the patients that you meet. It's a very interesting specialty.
Enjoy it. I think even if psychiatry isn't the career for you, there are so many opportunities that you'll be able to get within these posts.
No matter what career you go on to do in the long run, you can think back to things that you learnt, skills you learnt during your time in psychiatry, and thank the fact that you did it.
I think people can get quite blinkered, and if they don't really have an interest in psychiatry, almost go into a bit of the opinion that they won't get anything out of it. But actually there's so much to learn on psychiatry that is really important for your practice, whatever speciality you go into. And you actually have the opportunity to take the time, engage with patients and really think about the impact of what you're doing. So yeah, just have a really good time.
I hope this film has encouraged you to approach your psychiatry placement with an open mind. As you have heard, psychiatry offers a range of opportunities. Make the most of these, and you will end the placement with improved communication skills. You will be a better team player, and you will be able to work effectively with patients to help them manage their long-term conditions. Above all, you will become a better doctor. Together we can make a difference and improve patient and population health.